You may begin.
Thank you. Good morning, everyone. Happy Thursday. Um, Happy to see you all. We'll go ahead and call this meeting to order. The time is 8:06. And we'll go ahead and do roll call for board members to see who is present. You can say whatever you feel comfortable saying, as long as I know that means you're here. I can hear you. We'll start with roll call. April Meckens-Jolly, who I know is not here. Nebu Cohen-Cherry,
Here.
Deidre Griffith,
Here.
Colleen McNicholas, Dr. Melissa Tapey, Dr. Imbal Shackham, Liz Ebert, Dr. Barbara Luty,
Here.
Dr. Morgan Shields, Brittany Jones,
Here.
and Dr. Christopher Daly.
Here.
Okay, thank you all. For roll call, we are currently, let me make sure, we're one shy of quorum. So what we'll do is just hold off on approving any, the minutes from last board meeting, just because it requires a vote and we don't have quorum to vote. Should another board member join to give us quorum, I will circle back to that item at the end of the meeting. So with that being said, we could go ahead and move to the board committee updates, and I'll turn it over to Vice Chair Brittany Jones.
Thank you, Kristen. Good morning, everyone. Now we'll get a chance to hear updates from each board committee. I will actually turn it back to our board chair, Kristen, who is also chair of Community Engagement Committee, to provide updates.
Back to me. Thank you, Brittany. Just have a very brief update. We meet monthly, first Thursday of every month. The community engagement meeting meets. This month, we discussed several things pertaining to community health, public health. One of the larger things we discussed was just kind of talking about the landscape of public health in the city, which also includes the information that is coming out around one of our historic FQHCs, CareSTL. And the conversation around that was more so of just ensuring that city residents have access to different health opportunities that have all the longstanding being existing in our city to support in an urgent situation. Our hearts are definitely with our colleagues at CareSTL and hoping for the best. But a part of, I feel like our stance here is to ensure that public health is equitable and accessible to all city residents. So with that being said, part of the individuals on that committee is Dr. Melissa Tapey, who is the CMO of Affinia FQHC here in St. Louis, as well as Dr. Luty, who's on the call now. One of the things we just discussed again was just about access should anything happen or occur during that time where city residents are unsure of where to go to get urgent help. Affinia does have a convenient care that has been around. I refer a lot of people to it. I've used it in my clinical practice and throughout my career. I will pull up some information just to make sure that I'm accurate. One of the reasons why this was more so discussed is because there was conversation in the community about medication refills, and that's one of the roles that this convenience care could play. The reason why the convenience care is mentioned is because anybody can use that at any time. It doesn't matter where your provider is established, and this is not one of those opportunities that is trying to encroach upon their service area rather than just provide an opportunity if people need urgent medical attention. So the convenience care is on Limp Avenue. If they can take Medicaid, Medicare, and most private insurance. If it's self-pay, it's anywhere from $50 to $75 to be seen. And that's open. I believe that's Monday through Friday. They also have, or no, I think that was on the weekends too. I actually don't have their hours of operations on my notes. And then they also have an urgent dental care, the St. Louis Dental Center that's on Park Avenue, that's also available for any urgent dental needs that people need addressed. We also discussed with one of our other community engagement committee members, Dr. Barbara Luty, who supports the Pro Bono Clinic. That's a partnership with Washington University School of Medicine. This is usually open on Fridays from 1 to 5. This is located on 4444 Forest Park Avenue. If anyone needs to have a clinical appointment, it's again kind of like an intermediary where people can go and get their needs addressed and then follow up with their primaries. And I'm going to hold space for Dr. Luty if there was anything that you wanted to add to that at all, if I missed any pertinent details.
Yes, thank you. The only thing I wanted to add was that if you look under Washington University Pro Bono, there's a website where people can communicate with us by a form if they need an appointment, a little bit about their health care and contact information. The number is 273-5297. For us, insurance is not an issue, but our budget is a bit limited. But I would be glad to see anybody who's in need of like a checkup or some lab, basic lab tests or basic medication refills. We'd be glad to help them work something out. The clinic is only open from about 1 to 5 on Friday afternoons, and it's easily reached by the Metrolink or Metro bus system since we're right by the transit center.
Thank you so much, Dr. Luty. Also, just a list of resources that we discussed and wanted to highlight. Again, these are places that have been open and will continue these operations for as long as they have capacity to. The St. Louis Behavioral Health Urgent Care, that's on Vista, that is in partnership with the City Department of Health, is another opportunity. So some of the needs that we identify that are typically urgent are sometimes there's dental, the medication refill, so the medical convenience care and the pro bono clinic fits there. And then of course, behavioral health is always important. So just reminding folks, I know just me working in public health, a lot of people when they're in crisis don't remember the resources that are available to them. So this is just an opportunity for people to kind of know where those touch points are. And let me see, I'm kind of looking at our notes to see if there's anything else. In terms of that, we just, again, wanted to just elevate that and be supportive and offer information to ensure residents have access to care while a long-term plan is still being, decided. And I don't know if anyone else from the Community Engagement Committee has any comments on that front before we move forward with any other updates.
I can add really briefly that if anyone runs into a resident who's looking for care and have absolutely no idea where to turn them, Integrated Health Network is also a good place to refer folks to, and we can provide direct healthcare navigation to many of the resources provided today. And so not putting pressure to remember everything, but the IHN is also a good resource for healthcare navigation and rescheduling appointments and scheduling appointments with various FQHCs in our region.
Thank you so much, Brittany, for that update. And I think the last two things we discussed were more so medical resource shortages if people are unaware. Dr. Tapey was sharing a few things that she's seen as the CMO of Affinia, that there has been a statewide shortage for immunizations. It's been a little more challenging for them to be able to access immunizations for folks. I believe, if I remember correctly, what's happening is that I think the state kind of revamped how you can request the amount of vaccines you need. The quantity, I believe, was reduced on the terms of ensuring efficiency of use of immunizations. And so that's putting at least the FQHC that she works in a situation where sometimes they do have to let patients know to return for a future visit to get the vaccines if they don't have them on hand at the time. Is also my understanding that it is not exclusive to her experience, that the state has said that multiple other clinics, within the state have also reported some shortages on immunization. So just wanting that to be out there, that if, there's a future appointment and someone is anticipating on getting an immunization, that has been language that there's a shortage around those opportunities. The other shortage, which is ongoing, is there still is a national shortage for penicillin. Currently, they have not activated the emergency protocol in terms of like who will be treated first. Currently, from Dr. Melissa Tape's experience, that they have enough on hand currently to treat who they need to treat, and they haven't had to turn anybody away at this point. There has been discussions of sharing resources with the county, so that should Affinia, run out, that there is conversation and collaboration with the county to share penicillin resources. And should those resources become unavailable, then there will be a national response, or at least in our case, a state or regional response to prioritize, I believe, pregnant individuals and congenital syphilis cases will be prioritized should the shortage impact their ability to serve everyone who needs it. I believe the last report we heard was that the shortage is likely to go through Q4 of this year. So there isn't a near solution. So you're looking at towards the end of the year before, and that came from Pfizer, before they feel like this will be kind of settled. And that is all the updates that I have for Community Engagement Committee. Were there any questions or comments? Oh, I lied. I'll have to pass it to Shantae for a second. Shantae, we love when Shantae is able to join us. It really helps us understand the work on the ground at the Department of Health, and for us to use our experiences, expertise, and knowledge to share and support the great work that she's leading and doing. And Shantae, if you want to take a few minutes to kind of just talk over some quick updates that we discussed, would be fabulous. You're on mute, my love.
Once a day, folks. Thank you very much. So we have a lot going on. Outreach season has begun. It's outreach season for the Department of Health, literally being out in the community. Boots on the ground is from March 1st to October 1st. So we've already started getting invites to participate in several events. One major event that's coming up that I would like to make sure that people are aware of is on March 21st, and I'm trying to share my screen quickly so that I can show the ad for it. I hope everyone can see my screen. It's the Community Health and Resource Fair. It's going to be at the North County Recreation Center. This is a part of our collaborative, the St. Louis Partnership for a Healthy Community. It includes several community partners up to and including St. Louis County and our friends at Washington University, I heard. And there's going to be so much to do there, so much to learn, wonderful giveaways, great information. So I encourage people to stop by, not only our board members, but the community at large. And then also in our downtime, we made some major updates to our city webpage. We want to make improvements to make it easier for sharing information about everything, whether it's about our bureaus or about current impacts that are affecting our community. We also added, because we have started a video series called EpiMinute, a new multimedia page. And if you'd like for me to show that quickly, I can. we have so much going on here. This is our new city website. Can you see that the Department of Health webpage?
No,
And as you can see, we're trying to make
okay,
sure
we can't
that-
see it yet.
Okay, you cannot see it?
No.
Oh, all right, I guess that might help. Here we go. Sorry about that. Can you see it now?
Yes, thank you.
Okay, beautiful. So what you'll see is that we're trying to make sure that you're able to navigate very easily to things that are of most interest to you, whether it be information about how to file a claim for RECA, which is the Radiation Exposure Composure Act, Compensation Act, to our health reports and data that include up to our impact report, which we were able to go ahead and get online as well. But when you have time, feel free to navigate the health department's pages on the city website. Let's see, what else do I have for you today? Bear with me one moment. Okay, so again, we've already started our outreach season. There's a couple of things that we'll be attending, not only March 21st, which is on Saturday, the CHIP event, but we have opportunities to participate with St. Louis Public Schools, Alderwoman Pam Boyd's having a town hall. We're looking forward to attending that. And then, of course, there's some Easter health related activities or events that are occurring as well. Our health vehicle has been serviced and is ready to go. Actually, our first time out on the road will be on the 21st. And then finally, we're looking forward to National Public Health Week, which is April 6th through the 10th. We're going to be highlighting public health in action. So look forward to all the fun things that we'll have out on social media, on the news, out in the community. And then right after that, from April 12th through the 18th, we will be celebrating our animal care and control team. They are phenomenal, and we want to make sure that we give them their flowers. So that's all I have, and thanks so much.
Thank you so much, Shantae. Really helpful to see the website, and I really appreciate the Radiation Exposure Compensation Act resources. I think city residents often, you don't think it's for you because they talk a lot about the county, but if you've worked in the county or used to live in the county, then it's very much applicable. So I definitely appreciate that. And I say that just because I've heard the last time I went to a meeting that they anticipated about 300,000 residents of the region would apply, and it was maybe under 100,000 that had actually taken that step. And so appreciate that resource being there. Are there any questions for Shantae or any other community engagement committee member?
I do have a quick question, Shantae. How much time in advance does the department need for outreach requests?
It's preferable for us to have as much front end time as possible. So if it's a month out, at the latest, it would probably be like 2 weeks so that we can reach out to our bureaus. Oftentimes, they've already have events secured. So trying to see what opportunities are there or who's going to be available. The closer it gets to the date of the event is what's going to be the most critical thing. So at minimum 2 weeks, but the sooner the better.
Okay. Thank you.
Are there any other questions? All right, well, I'll turn it back over to you, Brittany.
Well, thank you so much, Community Engagement Committee. Now I will turn it over. I don't believe Dr. Shockham is here. So I will ask Deirdre if you're able to provide an update on the Academic Partnership Committee.
Yes, I can give an update. I unfortunately was not able to attend the most recent meeting, which was, I think, earlier this week. I was on spring break with my daughter. However, I know that the main thing we're working on is this kind of intern showcase, meaning we're trying to bring all of our organizations together for a single event. We're aiming for October. To number one, highlight the important work of public health. Number two, have the interns give the interns an opportunity to showcase what they're learning through their experiences in internship at the various organizations. at this event. And we've also talked about kind of also turning it into a job fair by inviting businesses outside of even the ones that the interns are assigned to. So we're working on dates. People are chiming in on that. Again, the goal is October, and we have a survey out right now for folks to fill in. And I'll check it when I speak to my executive assistant later to see what date is looking strong at this point. But that's our main project right now, this big public health intern event.
Perfect, thank you.
Welcome.
Now April is not here today, so I will either turn it over to Nebu or Chris if either of you have any updates on behalf of the governance committee by chance.
No real updates. We're on track. We're currently thinking through the board vacancies. And that's really the priority after passing the bylaws. So yeah, that's it. Chris, anything from you?
Nope.
I will probably just add that the board did complete the Sunshine Law training, I believe 2 weeks ago or last week. My apologies for getting the date. And if there are board members who did not get a chance to participate in the training, April has sent out the personal contact that you can schedule or reschedule an appointment with to participate in the training. Kristen, anything you wanted to add for that? Okay. All righty, thank you, Governance Committee. Now I will provide some updates on our quarterly joint committee. Due to everything that we're discussing today, and recent social and health issues pertaining that's happening within our region, we wanted to hold an impromptu joint committee meeting. We had one on Tuesday, March 10th, and we talked about a few things that were pressing in our region. We did had a follow-up discussion on the public health concerns around access to care and temporary care. Our board chair, Kristen, has been able to outline that for us earlier today, so I will not go into depths about that again, but really we just took some time to further share additional resources and ways for us to elevate one another's work to support communities who are needing some temporary assistance with healthcare navigation or obtaining and refilling prescriptions and chronic disease management. We also had follow-up discussion on the wonderful presentation that was provided by Kat Pittman at our last board meeting. We wanted to take some time to discuss that more as a board and think through who is actually engaged within the Community Health Improvement Plan work groups, and talk about opportunities for additional board members to be involved. We also brainstormed some ideas around how the board can specifically support the CHIPS vision. And so not just attending the priority groups, but also thinking through how can we leverage our own strengths and connections to support the advancement of the vision. And so next step for that, board chair Kristen and I would love to have some time to meet with Kat Pittman to further share some of our ideas and see if there are ways for the board to further be in support. And lastly, we decided to change our meetings from quarterly to bi-monthly or every other month, just so we can have some time to convene in real time, especially when advancements in our city is happening quite rapidly. So our next convening meeting will be April 14th, and then following that will be in June. And this concludes our joint committee updates. Are there any questions about that segment in particular? Okay. I will now turn it over to our board chair for updates on advocacy.
It's me again. It's budget season, everyone. If you're unaware, it's budget season. It's an extremely important time, specifically for public health, but especially for our entire city government. I will keep this update brief. High level, just some conversations and interactions I've been having. I did have a meeting with President Green as well as her Chief of Staff, Jay Nelson, to better understand the overall budgeting landscape of our city. If you've been following the news, and you may be aware of some impacts that have been occurring in terms of the entire city government budget. So if we're thinking about uplifting and advocating for public health, that is related to this, right? So if funding is being, what word do I want to use? If there's a concern around city government funding, then that will impact all of the departments that the city manages. With that being said, I needed to better understand. I love to fact check. I like to make sure that what I understand is accurate. And so had a meeting to clarify some things. Also wanted to better understand the lawsuit that President Megan Green had put in place last year because of the budget concerns around the Board of Commission with police. And that conversation was extremely fruitful and welcoming and transparent, which is one of my favorite conversations to have. So it really does help support any advocacy opportunities that the board may do on behalf of the city, as well as especially because of public health. What I will say is that we'll be sending out information later in terms of ways we can plug in. So I'll be working on drafting things that will be, there's always public comment opportunities. There's been a lot of information sharing on social media lately around this topic. Several constituents were present at some of the most recent public comment meetings, one being the Board of Aldermen meeting, I believe. That was about a week or so ago. And I think the latest meeting I heard about was a tornado recovery meeting. Folks have been present. I anticipate to give public comment at the Board of E&A meeting that usually happens in April. If I can remember last year, I did public comment last year on behalf of public health then, and I plan to do the same thing. It is welcome and open to anyone. And we'll talk about this further in our joint committee meeting, and I'll be sending email communication to the board for any opt-in advocacy opportunities that you all would want to get involved in. I think that is as much as I want to say. In your conversations, just always advocate for funding. If you don't know, public health is one of the departments that gets the least amount of the city's overall budget. And I think when I joined the board, it was around 1 or 1.5%, and maybe had gotten up to 2.5%. And even that increase may be at stake. And a good functioning board from a national level in terms of how much funding they get is usually about 5% based on the research that I understand. And so just know that we always should be thinking about funding opportunities for the Board of Health. And this is a great opportunity, not the Board of Health, for the Department of Health. And this is a great opportunity for us to plug in and leverage our relationships and funders or opportunities that we can position public health to be in a space where they can get what they need to continue the great work that they do, considering the heaviness the city has had over the last year in particular. So I will not belabor this any longer. If you have questions about advocacy, please let me know, which also leads me to, I do know that Commissioner Nwari is, at least you can correct me if I'm wrong, did attend MOFI at the Capitol. I did see some social media things that we shared with board members of the one pager that they presented on behalf of the Department of Health. Lord help me with my words. And just that's a really good one pager as well when you're having conversations with folks and you need some talking points. I felt like it was pretty comprehensive around programming and some highlights that highlighted the programming and the work the Department of Health does. Do I have that right, Commissioner Nwari? Is there anything you want to say about that? You don't have to.
Have it right, and it's available if anyone wants it. Thanks for the advocacy.
Okay, that's all I really have from my advocacy update. Back to you, Brittany.
Thank you so much, Kristen.
Yeah.
Well, that concludes our committee updates section. Now we will pass it over to the Department of Health, is that correct, for updates.
Good morning, everyone. So Kristen just asked me to talk about or share a little bit about what's a project that's priority for the mayor that all departments in the city are being requested to contribute to. And so basically the project is around transparent government and providing high-level updates on our, our work and how well it's going, both from what we do level, like what our outputs are, but also what how it's flowing and the process of the work. So are we improving in sort of our quality improvement? So the department collects so much data, and it was, as I was sort of looking at the entire department and comparing ourselves to some of the other departments who may have, a singular points of data, I was trying to figure out how to organize our data in a way that made sense for the mayor's office. And this eventually will all roll up into a semi-public some data will be public on a dashboard that they're calling CityStat. Some data will be internally monitored, but the whole point is around high quality city services and transparent government. So Kristen just asked me to go over, I'm not going to go over all the data points, but I just wanted to share, and she thought it would be helpful for me to share just the categories of buckets that we are kind of leaning to report our data out at a high level. So the first bucket is enforcement, regulation, and compliance. So that will include most of our work through our Environmental Health Bureau, which includes food and beverage inspections, community sanitation, air pollution, animal care and control. And then from our family community school health, the school age immunization compliance with parochial schools. The second bucket is screening, early detection, and access to care. So this includes all of our direct services, such as lead screening, TB screening, treatment, and Medicaid TB treatment and case management. Our Health Stop Clinic, which provides HIV and STI testing, our perinatal HEP screening program, our behavioral health urgent care linkage to care program, and then other general screenings, such as in the community if we do blood pressure screenings and the like. It will also include our facilitation of access to care. For example, we have several contracts with many providers in the community, including those to do immunization, vaccinations, as well as doula care services, and other testing that we do, as well as through our opioid settlement money. We have contracts out there providing behavioral health linkage to care. So that's the second bucket. The third bucket is health education, which is inclusive of chronic disease, infectious disease, and environmental health risks. So that'll include all of our communication, social media, print media, all of our outreach and engagement activities, the things that Shantae talked about. So events, material distribution, classes, referrals as a result of outreach and presentations in the community. And then our fourth bucket is assessment, readiness, and response, which includes all of our surveillance activity, our production of epi briefs and reports, our case investigation work, our outbreak control work, our emergency preparedness, public health emergency preparedness work, and then any customer service surveys, focus groups, and surveys in the community. And then finally, our final bucket is fiscal stewardship, which will include all of our number of grants and contracts coming in, accounting of those, required reporting at a high level. That's all I have, Kristen. Let me know if there's any questions.
Does anybody have any questions about those 5 buckets? I am particularly excited to see how this work will evolve and appreciate the intentionality around just how the work is being done. And I think we can always look at the work that we do and see where there's areas of improvement. So it's really exciting to hear about. If there are no questions on
I do
that.
have one question. It's probably just a comment. Victoria, we at BJC are this is a year we want to try to coordinate our screenings process a little better amongst the different entities. We get requests to our department. We have a community health services team. There's Sitemen, there's children's, there's our Gold Farm School of Nursing. So our team is working on that. And we've also talked about, coordinating with SSM because, when community groups reach out, they may reach out to SSM and BJC at the same time. Sure, they're reaching out to the city as well. So I guess I'm just throwing that out there in case there's an opportunity to further align just for the sake of the benefit of the community, right? All the screenings options when they are requested and work with each other to, if we can't do it, you guys can do it. If you guys can't do it, SSM, something like that. So it's probably a deeper conversation, but wanted you all to know that we are working on that at BJC for this year.
Thanks, Deidre. And yeah, you and I spoke a little bit about this potential, and would love to have an offline conversation and bring in Shantae and maybe others to kind of think through that in a more coordinated way.
Okay, sounds good. We'll reach out.
Thank you so much, Deidre. Any other questions? Okay, if we move along and something grabs your mind, and hit the chat, or there'll be an opportunity later to address that during announcements. We're going to go ahead and move over to the next item from the Department of Health. They sent out their impact report, which you should have received in your inbox, and that showcases the incredible work that the department does every year. It is one of the most anticipated reports that I get excited to see, just so that I can learn all the different things that the department is doing. So with that, we wanted to make sure everybody had access to it, which we know we've sent it out to the board. And if folks had questions around the impact report, we wanted to hold space for you to get those questions answered by no one better than the staff that work at the Department of Health. So I do have a question, but I don't want to kick it off unless another board member has a question they would like to ask. So I will open that up to others first. All right. Well, looks like I'll be kicking it off. So my question, one, just want to congratulate you and your team on the incredible work that you all do. It's been a very trying year in the city, and you all have persevered under leadership changes, as well as tornado recovery, as well as sinkholes and all the things that's been happening. So really appreciate your continued support and intentionality in serving your city residents. I had a question around, I want to look at the pages early on. It's around your staff report. And I wanted to clarify or get clarity on, I believe if I remember correctly, the numbers were 32 vacancies and then 32 filled positions or something like that. Does that ring a bell to anyone on the staff, those numbers? Yes, thank you for whoever shared their screen. So 32 vacancies and 32 new hires. I wanted to clarify, because I do know that there are some positions that are open, like how those numbers reflect what's actually, like what positions that were vacant are filled and how many positions remain. I think that's probably the clarity I was looking for. Or if you all filled all 32 of the positions that were vacant.
So the way I understand not the way, we have our TO, or table of organization, includes 173 total positions. During the calendar year, we had a total of 141 filled, which meant we had a remaining 32 vacant. Also, during the time period of the calendar year, we promoted one staff, one person left, and we had 32 new hires. So it's just data that happened throughout the calendar year. It's
Okay.
flow of hirees throughout the calendar year.
So there were several positions open, 141 got filled. There were 32 left over. I appreciate the way you explained it, and I think I guess I'm trying to understand how many. So is it 32 vacancies that remain for the department?
2 vacancies during the calendar year of 2025.
And then only one person left was sent away, or just it's just one.
Yeah.
Okay. Okay. How is that more of an internal tracking? Like there's like no other publicly available information to understand like when positions are exited. When I think about us advocating for positions that need to be filled, I was recently on the city website looking at positions in public health to share with folks who are looking. And so that's why I ask about turnover. I couldn't remember if I saw a turnover report or not, but it is common to have turnover annually. And I'm very surprised that it's only been one person. Okay. Does anybody have any other questions? That was my main question. I think I just was trying to understand the numbers to think about where the vacancies are. When you think about budgeting season, what resources are available and how many salaries are, allocated for and what salaries are not, if there is any room to reallocate unfilled positions and things of that nature. So that's kind of driving my ask. Does anybody else have any other questions around this? The impact report?
I mean, just out of curiosity for the total vacant, is there and this might be somewhere in the report, is there a larger group? Like, what's the largest category, if there is one, of the type of open positions? Does that make sense? Is it nurses or, I don't know, field employees? Maybe we don't know. Which is totally fine. I'm totally just curious.
I'd have to look at our TO. I know that we do have a struggle filling our nursing positions. So if you all can advocate on helping to get us nurses, that'd be great. But I'd have to look into it more detailed to see specifically what positions frequently are vacant.
Sounds good. Thank you.
Any other questions from the impact report?
I'm just maybe in alignment with the positions filled, but is there an update with the health director position?
The health director position is appointed by the mayor's office, and the mayor's office has actively started to look for candidates, but that's all the information that I have.
All right, thank you.
I have a question. I don't have a direct question regarding the statistics in the report. I really appreciate the report and the staff shout outs. I think that might be new. I think it was the first time I've seen that, so I really appreciate getting a chance to see that and celebrate staff with you. My question is regarding all that has happened last year and reviewing the report, how, if at all, has that informed the way that you do outreach for this year? If there were things that happened last year that you want to make sure that doesn't happen next year, or areas or certain like either focus areas or neighborhoods that you want to really dive deeper into this year. Just curious on how the 2025 has impacted or informed, not impacted, informed the way that you do outreach for 2026.
Well, the most significant thing that happened last year was the tornado. And what we've learned is that our capacity to serve more residents can surge as needed. And so, we saw almost triple the amount of residents that we usually see per year. I think another thing we learned, and I'll turn it over to Shantae also to add some insight. And I think another thing, not that we learned, but that it just shows the tremendous commitment to residents that our staff have, is that all of our departments, even if they're not, related to the tornado or do, work in those specific areas or outreach work, stepped up to do a lot of the outreach work in the community. So we've had some of our environmental health staff going out in the community and doing canvassing during the summer, during the tornado. Also, we had our behavioral health team out in the community doing canvassing. Our family community school health team doubled down and did more outreach and canvassing in the community. And they did that during the summer, when there was a heat wave, as well as during the volunteering for the winter outreach efforts this year, which were very different from prior years, including shuttle service for residents during the Code Blue. We had our team really take the lead there with staffing the shuttle. So I think the things that I wouldn't say learned, but I think our department continues to prove is its commitment to the residents of St. Louis. And I'm overjoyed for them to just go over and above to support the community. Shantae, anything you want to add?
Yeah, I did want to also add that in light of the tornado, which definitely took priority for any of our community outreach for 2025, which essentially kind of skewed any kind of data collecting that we would normally do in a year where all things are equal, where we could just identify where we were actually, most present, and areas where we definitely needed to pay more attention or to make connections. Languages. We wanted to make sure that we were able to ensure that we could provide information to all that we serve, regardless of, what languages that they speak. And so we were very intentional coming out of this event with expanding the languages that we have available, materials and information that we have available, and in how many languages, which is now up to 10. So I think that was one of the major takeaways for us that was definitely helpful, and will be able to utilize going forward with the Office of New Americans and then other international organizations out in the community, our community partners that serve, different communities within our city too, that would benefit from having those extra language materials about the services and information that we provide. So, yeah.
Thank you so much.
Does that help?
No, yes, that's exactly what I was looking for. I wanted to also get a chance to hear from the team, like what their major takeaways or excitements were from 2025. So thank you.
I have a few more questions. One is a shout out. Really excited to see that there, if I remember correctly, funding available for staff who currently aren't certified in public health to get certified in public health. I think that's extremely cool. So really excited to see that. I think that only just improves opportunity and access as you all advance in your work. So kudos to that initiative. The other question I had, I was looking at the outreach reporting, and been booked and busy. I think it was over 14,000 folks that you all have reached in the year, which makes sense given all the things that happened in the city. It's great to see that trust being built in the community. So that's incredible. I think my question was around the zip code that was most visited, I guess is my understanding.
Mm-hmm.
Is it correct that zip code is also not too far from where you all are based?
So yes, to answer your question, it's yes. However, with the tornado response, where the Disaster Assistance Center, it was called the DAC, and other places where we convened to provide services for those that were impacted by the tornado, also falls in 63103. And so that's where our focus remain for most of the outreach season. And so that's why. Again, I feel like this season 2025 is rather skewed due to the fact that we had to respond and make the tornado response priority. So it'll be interesting what it looks like at the end of the 2026 season.
Sure. No, that actually is extremely helpful. Not that I forgot about the deck. I was there, but remembering how many people visited that, I think it was open for at least a month, if not a little longer. So it makes sense that you all were. I was like, oh, were they doing outreach outside their front door? So I just had all the questions, but that makes sense. Thank you for clarifying that. And I think my last question, I was looking at some of the communicable disease. Sometimes I can't say that correctly. Data reporting. And I was curious, just because of the political landscape across the nation, if you all saw any impacts on your work as it relates to supporting Pride events, given the DEI pressures that come from the federal level. If events have been occurring as usual, have you seen like a decrease in events to participate in? I know there's been major funders that have pulled out of supporting certain events in our region. And so I didn't know if that impacted your work at all and the ability to support community members.
Would you or would you like Quinn to? From my perspective, from an outreach perspective, our HIV prevention team, they moved forward as best they could, regardless, in spite of, so they made every effort to make sure to stay with their commitments, what they'd already been. And I think that also there were smaller agencies that had been impacted, but we have such strong partnerships that it was business as usual for the most part. In terms of our larger events, such as Pride, again, that's something that was not going to be impacted by this. It was business as usual. Our public health teams, our community partners are committed to the health and well-being of all of our community. And so we weren't going to let that be impacted, or we minimized as much as possible. I hope that helps.
Thank you. Quinn, did you want to say something as well?
And for everyone's awareness, just health services manager too, I'm responsible for communicable disease. As far as the political activities impact on our programming, I would say that we saw most of its impact as it relates to tuberculosis control. So we see in that population mainly refugee migrants and immigrants at our TB clinic. And given some of the things in the news, we have just seen less response to our referrals, less kept appointments, and most in conversation is because due to the political landscape. So when it comes to our TB control, I would say that our impact was not so much as our funding or the things that we were doing, but more so in the presence and participation by the communities that we see. As you all know, of course, there was some funding lapses when it came to HIV prevention, but as Shantae said, we moved on business as usual. We currently have not changed any of our messaging because it has not been required of us, but we do know that is something to kind of be mindful of when, as far as terms that may be banned or used differently at the federal level. So we're just kind of mindful and awaiting to hear back on that. But as it stands right now, our communications have not changed.
Thank you so much, both of you. That was really insightful. Thank you for the tuberculosis update. I hadn't even considered those impacts on community members that are migrants from other areas, and so that's really helpful. I don't have any more questions, believe it or not. So does anyone have any other questions about the impact report? Okay, again, we celebrate the work you all are doing. We're excited to see and hear about all the great work you're doing. So keep going. And I think the last item for the Department of Health updates was quality improvement projects, Commissioner Nwari.
Thank you. So we have two teams on today to talk about two different quality improvement projects. They each have a total of 15 minutes, so we're right on track. I'm going to start with Justin to introduce his team for food and beverage. Justin Hauser is our HSM, our Health Services Manager 2 over Environmental Health. Justin, please go ahead and introduce your team for the presentation.
Thanks, Commissioner. Good morning, Chairperson Simpson. Good morning, members of the board. Thanks for the time to let us present about the hard work our teams are up to. We have 2 staff members from the Environmental Health Bureau, Food and Beverage Control Section. Stephanie Salvator was one of the lead members of the Quality Improvement Project. She'll be leading the presentation. And we also have the Food and Beverage Control Supervisor, Rich Eskew, as well. This was kind of a joint effort between leadership and the team, and I'm excited to hear the presentation as well. So with that, I'll turn it over to Stephanie, and we'll get right into it. Thanks, everyone.
Good morning. Good morning. Can you all hear me?
Yes.
Uh-oh. Okay, good. Hi, my name is Stephanie, and I am a food establishment inspector here in the Department of Environmental Health. So I was one of the members of the team for the QI project last year, and our group was given the task of creating a plan to help our inspectors improve the timeliness of inspections and to reduce the backlog of past due inspections. Next slide, please. So here's a little bit of the background on it. Up until a few months ago, we were facing a pretty large accumulation of pending and overdue inspections. We had kind of a hard time keeping up with the inspections that were due each month. And this created a number of problems, such as establishments being out of compliance or creating the potential for a lack of attention to creating sound and wholesome products. Next, please. We created this aim statement. It helped us be able to set the goal of increasing inspection percentages and reducing a backlog. So if you're familiar with QI projects, you start with a whole bunch of these tools and kind of throw things at them. So this is kind of the beginning of what we did. We started with the same statement, and then we used a couple of tools. Root cause analysis was one that was really helpful for us because we were able to just throw everything we could think of that could be causing these late inspections. It's kind of nice to use to be able to sketch out the issues. And it also helped us produce a list that we were able to pare down to a few things that were really the problems. So the ones on there that are circled, we kind of grouped those together and formed kind of a list of those things. Another thing we used was a flow chart. And that looks like a lot of information, and it is, but this is kind of a day in the life of an inspector. You know, we get in, we look at our reports, we kind of make a plan for our day, we get things together, and we get out in the field. When you get to the end there, keep in mind that that's not the end of our day. That's just the end of one inspection. And we do that multiple times a day. It could be 4, it could be 6, it could be 8. It all depends on the level of complexity of the inspection. So with that, we came up with some objectives listed there. They became pretty clear with those tools that we used, but they kind of came down to just these 4 goals. And I think the most important one is that we were able to put a supervisor in place. We had a couple that didn't really work out. So luckily we got one that came with a lot of experience since he's been with the department for 20-something years. I'll let him tell you about that. But he is great because he knows the food code and kind of inspection protocol front and back, and is a great resource for us. So with the challenges we had, Richard was able to come to us with our project and kind of suss out what we had to do. He had the knowledge of these challenges because he was actually part of our team before becoming the supervisor. And so he took these recommendations and came up with a list of our plans. So the improvements, the good news here is that between the time that Rich got here and today, up to now, we've made huge strides in reaching our goals. Rich is going to talk about that next. But I think our key success factors is not only that the project and hiring Rich helped us improve our numbers, I think our morale as a group is increased because our desire to do the work and get it done better and faster and still do quality inspections. And I think part of that is being able to explain the whys of the tasks so that everybody understands. With that, I'm going to let Rich talk about the numbers that we're so extremely proud of.
All right. Good morning, everybody. So I get the fun part of talking about the team's accomplishments. We got a good start on these projects in November, and we really started seeing results through December. I mean, starting in December and through February. One of the first things we realized was we just simply had to get more inspections performed. We used those QI tools and the recommendations that Stephanie talked about, and we just went ahead and put all of them into practice. So here just kind of shows some of the results of how many inspections we were performing. You know, if you look at November, we just compare those to a year ago worth. We did 397, and in this past November, we did 551. So we just did some more organization and some training involved in there as well. Whoops. There. And we had to get rid of that backlog of inspections. Some of this was already starting to come down before December, but still, if you kind of compare this stuff to where we were the year before, the staff really got focused on reeling that number in. If you look at that December number, we were up over right at 300 inspections that just were late. We just were late getting them accomplished. Got that down to 60, and then by this past November or February, our previous year we had a couple hundred of them. This February we were down to 9. And then let's talk about, this is where we were really headed for, was getting these inspections done on time. We initially thought let's shoot for about 75% on time, since we were not at that number. Then we changed that to 85%. If you look in December, those were our current year. This year was at 70, where a year ago, for some strange reason, we were at 80. And in January, we were going against a 49% on time rate. This year we were 74. And in February, we were going against 57% on time. And then this current year, we're at 97% this past February. I have started looking at the March same comparisons, and it looks like we're going to do another repeat again this March. Now, for our own review, we'll break these things out into further, and we separate each of the complexity levels of our restaurants. You know, our inspectors of all of them have improved their performance individually. Another really a nice side note is that we still have the same staff as we had the prior year, minus one inspector. So these guys are all just been cranking, and they're so involved and focused on getting the work done. We're really looking forward. We have our new person starting next week. We're looking really forward for that person to come in. And like I said, everyone is focused. At any time, you can almost walk up to anybody and say, so where are you at with your inspections this month? And they'll tell you exactly where they are. They also work well with each other now, going, hey, I need some help to get this one done, or to get a couple of these done. And people are stepping up and helping each other. With all this new focus, so I'm excited, and I know we can help, which is our ultimate goal, is to serve safe food to our community through our restaurants. Anybody got any questions for that?
I always do have some things. First of all, amazing presentation. I love a good QI project. So I really think the way that we, evolve the work that we do is by looking at the barriers and challenges. So I deeply appreciate, showing those. Um, I just want to shout out you and your team. And if I heard correctly, from what Stephanie was saying during the presentation, is the leadership made a huge difference. And I was curious, has there always been a supervisory role associated with this group? Or was that one of the findings out of your research that determined that leadership was needed and the supervisor position was created for that, was my question.
There has always been a supervisory role. We did go through a couple of different supervisors before me, but yeah, there's always been a supervisor position.
Okay. And when did you start in your supervisor role?
November 3rd or something, right? The first part of November.
Of last year.
But
Okay.
yeah, now I've been with the food and beverage team for 23 years. So
Oh, okay. Now
in the inspector role, yes.
And was there like a lag between your leadership and the previous leadership?
There was. I do not remember how long that was. Justin
Okay.
may know that a little more. I don't remember.
Yeah, it was over a year.
Oh, wow. Okay.
Yeah.
Well,
Which is,
thank
I think, why we lagged in morale too. We didn't have a whole lot of support other than Justin, who has a million things to do. So we got great support from him. We tried to support each other, but when you don't have someone steering the ship, you kind of get off course.
Well, congratulations. You all have done incredible work. Seeing the comparison of what was and what is massive, and you all should be extremely proud. I just want to take a moment for anybody that's watching. This is what public health does. So when y'all thinking about funding and you think health is beyond just like your clinical visit, it is the safe food that you eat, the opening of restaurants, and ensuring that you all are ingesting safe materials. And so I think that just needs to be named explicitly, because I don't think we think about the broadness that public health does for the city. And
Can I mention one more thing also? We don't do just restaurants. When you think of food inspections, it's anytime you're putting food in your mouth. So it's hospitals, nursing homes, childcare facilities, bar and grill, restaurants, obviously, taverns if they're serving snacks. So really, we have more than just restaurants. Hospital cafeterias. What else, Rich? What else do we have on there?
Well,
food
altogether,
trucks.
Yeah,
food
altogether we
trucks.
have about 2,800 food establishments in the city.
Wow. Every time
Yeah, so yeah, every time you eat somewhere, think of us. Yeah.
That's right. I love that. Thank you for clarifying that for the people and for myself. Learned something new today, and I love to learn. So I appreciate you both so much for your presentation.
Thank you.
Does the board have any other questions before we move on to the next presentation? In the chat, Craig says Mardi Gras stadium and temp food permits. Grocery stores. I mean, y'all just saying.
Yeah.
It is
We
in
work weekends a
day.
lot of times. Yeah.
This is part of a public health funding language. People care about what they eat, invest those dollars. I said what I said. Okay, moving on to the next presentation. Victoria, if you would like to.
Thank you. Great presentation, Rich and Stephanie and Justin. Thanks. Now we'll move on to the second QI presentation. I'm going to introduce Quinn Hill, who is our health services manager over both communicable disease as well as family, community, and school health. This project is out of the Family and Community and School Health Bureau. Quinn, over to you. And Stephanie, you can put your hand down. Thank you. Quinn.
Thanks, Commissioner. Yes, as she mentioned, I'm the health services manager too over communicable disease as well as family, community, school health. This quality improvement project. Oh, that was perfect. Bhavna, if you just want to share the presentation again. but this project comes out of the Family Community School Health. It was quality improvement team included other staff members in the Department of Health that were not just in FCSH. We also had team members from communicable disease as well as our communications and outreach team. And then of course, we had some really great support from Shantae. Alrighty, so our project was called Hall Pass to Health. It is our way of improving health education in the St. Louis schools. I'm going to give you all a little bit of background, and then afterwards I will hand it over to our public health program rep in health education, Bhavna, and I will hand it over to our nutrition program coordinator, also in health education, Donald. Next slide, please. All right, so just a little bit of background on our quality improvement on our QI project is, so with school health, COVID-19 as well as some other things disrupted the traditional school health screening models, as COVID-19 disrupted many services within the city and nationally, as we know. So with the pandemic, prior to the pandemic, we at the health department would do things like vision, height, weight, those types of screenings traditionally in the school system. Following the pandemic, we no longer had an MOU in place or a memorandum of understanding that allowed us to go into the schools. It also just was not safe for us to go into the schools. And so kind of the ways in which we would screen or even interact with the school systems and the actual schools was disrupted. What happened afterwards was we would receive phone calls or emails anytime something would kind of happen in the school. So if they had an outbreak of some sort, whether it be STI or respiratory, etc., and they needed someone to come in from the health department to either give a presentation, screenings, or any kind of education, those types of things became ad hoc, right? So that gap kind of left us with an opportunity, and how we filled that opportunity became a little bit more reactive and non-standardized, which ultimately caused delays in health department responses. And then, of course, the usefulness of the health education content that we were developing. Unfortunately, this, as you all know, this target audience is evidence shows that our children and youth face complex health burdens that far exceed traditional health screening. So even with what we were doing prior to the pandemic, with vision, height, weight, it didn't really cover all of the needs of the school system or the students, parents, or teachers there. So we kind of found ourselves we have an opportunity, we have a gap that we could possibly fill back with health screenings, but how could we also actually tailor the ways in which the health department interacts with the schools, and can we standardize the way that we can do that? So our QI project was led by the question, how can we move forward from a reactive system to a proactive and standardized approach that truly meets needs of the schools? And I will let Bhavna and Donald tell you how we did that.
Thank you, Quinn, for that concise introduction. I'm trying to move the slide, but it's okay. So with that question in mind, we are now on a mission to safeguard the health and well-being of our city's children and youth while empowering the community with the right knowledge to improve their health. And to move towards this aim, we aim to improve health education for schools by implementing a standardized request and a feedback process with the school stakeholders and participants. We set a clear timeline to get there. Step 1 was listening. We assessed our school stakeholders, which gave us the insights of what our children and youth actually need. We soon will pilot the standardized request system with a built-in feedback loop to update our teaching tools and modes of delivery by May 2026. By December 2026, we want to develop a baseline. Our target is to have 95% of all requests flow through this new system, respond to 95% of requests with a 2-week turnaround time. At least 50% of our partners reporting they are highly satisfied with the coordination, and 50% of the feedback we receive from the health education participants reporting they are highly satisfied with the materials we share with them. And we also want to improve the referrals to preventive health services. So these measures, we are expecting to increase it over the time. And ultimately, we aim to improve community health outcomes through improvement of service coordination. Insights from the Needs Assessment Survey. We surveyed around 422 schools in the city of St. Louis and received a response rate of 12.6%, which exceeds the average email response rate of more than 10%. Health education topics requested by school stakeholders for all grades was really eye-opening for us. The red indicates health education topics requested by more than 50% of school stakeholders. Mental and behavioral health stands at 74%. Hygiene, which includes dental, hand washing, etc., this stands at 60%. Online safety and bullying stands at 58%. Blue indicates health education topics requested by less than 50% stakeholders. Healthy lifestyle stands at 43, medication safety, substance abuse at 43, asthma, vaping and tobacco, these two stand at 40% of all the requests. So there were other requests were also there nonetheless. We knew we can't use one size fit all approach. We needed to understand exactly how priorities shift across different developmental stages. So what we did is we broke down the health education topic requests across different grades, which confirmed that priority shift. In dark blue, from daycare to high school, mental and behavioral health requests never leave the top spot, reaching a peak in high school. In dark green, we see that requests for vaping and tobacco increase steadily with increase in grades. In light blue, bullying, and in gray, online safety topics follow a similar rise with increase in grades. There were also health topics which reinforced what we already know. In light green, the traditional lead screening, which is a priority in pre-K, has dropped to 0% in requests by middle school. This is because our lead screening programs are designed to screen children from 6 months to 6 years. In dark yellow, infectious disease. In light yellow, immunization. And in orange, unintentional injuries. These health education topics see a decline in requests with increase in grades. This suggests that foundational hygiene and safety topics are prioritized primarily for younger students, while mental health and substance abuse becomes more sought after topic for adolescents. This comprehensive breakdown now allows us to stop guessing and start tailoring our health education materials. I would like Donald McGee to present the remainder of this presentation.
Thank you for that, Bhavna. So as we move forward, we asked, as going through this QR project, we asked the school stakeholders, what were some of the gaps or some of the barriers that were experienced during the time of this this being conducted. So some of the things that they stated were that it was inconsistent curriculums, there was critical topic deficiencies concerning with online safety, and for the barriers, it was logistical barriers. It's more of a cultural and language barriers, also following with financial barriers. And within that, if I can go a little bit of the inconsistent curriculum, it was just health education was often given within a periodic time, or it was optional, or had less of structured requirement throughout their curriculum. And for critical topic deficiencies, it was a major knowledge and training gaps for specific and reproductive health, mental health, coping skills, and or personal hygiene. And for the concerns with online safety was something that was just critically missing within their programming or curriculum within the schools. And I feel that it's important as we're going through today's time with everything being online and or through AI mechanisms. And for the barriers, we had logistical barriers. So it was just scheduling constraints, difficulty finding guest speakers and or lack of dedicated point of contact with the DOH for helping other partners. With the cultural and language barriers, it was just a preventive or a preventing effective communication, between parents. So some of the things or the information that was relaying within the schools to the parents were not relying or making it back home through them and home. And then with financial barriers, the schools claimed that there was a budget constraints that limited access for them to have quality hygiene supplies and or programs providers. You can go to the next slide, Bhavna, please. So these were just a couple of considerations for our continued QI improvement. So as you can see, one, we had integration to the existing curriculums. Two, health literacy and developmental appropriateness to address the critical topics and deficiencies. Multicultural and multilingual accessibility, enhance and improve collaborations with interdepartmental and community partners. And then just solidifying the memorandum of understanding or the MOU within the schools. I can go into depth or answer any questions about this slide once we finish because it's a lot of information. I don't want to take up too much time. Can you go to the next slide for me, Bob? So as more of a continue for this considerations. So in the innovation, we wanted to make sure that we had to develop a central hub. So that would just be, that would be somewhere where it could be a single point entry for everything to be resource. So it's for request of services, access materials for education, understanding or knowing who their primary contact for the DOH would be with any of their assigned wants. And then with the sustainability and the community empowerment for sustainable actions. So for parent and guardians, we had received 94% respondents wanted parent or guardian trainings for education. And for the school staff, they wanted 69% respondents wanted more teacher and staff trainings for the teachers within the schools. We can move forward behind that. And so as we move forward from that, our next steps or final steps within conducting the project was just to have a pilot. So we did that with standardized request forms, feedback forms, and understanding and having an implementation guide of what's going on. So next, then we completed indirect compliance requirements, which we still needed to have our backgrounds checks to be able to go in the schools and then have a completed MOU with the schools. Quinn will be able to tell you more about the MOU once we finish the project. Finish the presentation if you have any questions. And then just a coordination with process for cross-department requests. So with that, it would be more important to have the specialized workers in that field. So if they request anything for mental health, we want to have someone who is from the DHB or the Behavioral Health Bureau to come in and give the appropriate information or what's needed to be taught or presented in the schools. And then just wanted to make sure that we had an update in health education materials for anything that's given out or anything that's requested from the schools to make sure we have everything that's up to date and the right information that's going on. So that's what we have. Thank you all for listening. We appreciate you. Thank you to the QI team and everyone, Quinn, Bahavna, Victoria, Commissioner, and Weary, and Shantae. So if you have any questions, we open the floor for you guys now.
Thank you all so much. We definitely appreciate you. Thank you, Quinn, Donald, and Bhavna. This is such a robust and wonderful presentation. One of the things that we always grapple with at the IHN is the benefits and the limitations of screenings. And we're always trying to figure out what is the best way to do both. And so I'm overjoyed to hear about the ways that you're tailoring and really trying to get community input so your work and your impact is related and directed properly. So this is very exciting. I know we are running a little behind on time. I think if Board Chair Kristen, if you feel like this is appropriate, I'm wondering if we save questions for at the next meeting that we can provide questions or ask questions via email because of time. But I'll go ahead.
Yes, I would agree. Just to be mindful of, the time and want to respect everyone and their schedules. If any board members have questions, you can directly reach out to, would it be most appropriate to reach out to Quinn as lead? Is that okay?
That works. I'll put my email in the chat.
Perfect. So if you have any questions on that presentation, please email Quinn, or you can also, elevate it to us and we'll make sure that it gets to Quinn. Just want to celebrate you all. I don't know. I love QI projects. That's where my brain just thrives because our work is to fill the gaps. And if we don't assess the gaps, then we never know where we need to put more energy. And I just really appreciate how thoughtful you all have been in your approach and how transparent. I absolutely love transparent conversations. I think your assessments from both QI projects may help some other, organization that may be viewing this. So maybe we should, investigate how our workflows are moving and how we can improve it. So just super congratulations to the team. And without further ado, it is 9:30. So I would like to go ahead and make one announcement, and just to say that our next board meeting is scheduled to be on April 16th. Same time, same place on Zoom. If you're not getting your Zoom links, please let me know, or you can also reach out to Shantae and she can be sure that you get what you need. Otherwise, I would like to move to adjourn this meeting at 9:30.
Thank you. Have a good day, everybody.
Wonderful